Hi, Mr. Quick. I'm Brandon, and I'm applying to web this year. I believe you've seen 30s of my brothers and sisters, but guess what? I'm special because I have to do this physical examination with Dr. Yufi today, and she will show you all the regional terms, medical terminologies, and body planes. Are you ready? Alright, so now I'm lying down facing up, which is my anterior side. It's also called the ventral side, which is the front. And now I am facing downward, which is the posterior side, also called the dorsal side, which is the back. The upper part of my body is called superior or cranial, and the lower part of my body is called inferior or caudal. The line on top of my head in the middle, it's called the medial, and the direction that's away from the midline, it's called the lateral, and in between of the medial and the lateral, it's called the intermediate. Now imagine a cat scratches you, which touches your external surface. We call it superficial. And now you're being robbed and someone stabbed you with a knife, and it touches your internal organs. Beneath the surface, we call it deep. Point of the origin is called the proximal end, and away from the origin is called the distal end. Let's get this physical examination started, shall we? Okay, my head is called the cephalic. My forehead is called the frontal. My eye is called the orbital. And my nose is called the nasal. My cheek is called the buccal. My mouth is called the oral, and my chin is called the mental. It has nothing to do with your brain. And my neck is called the cervical. Looks like my head is fine. Now let's move on to the body. So my shoulder is called acromial. My breastbone is called sternal, and my breast is called mammary. My chest is called thoracic, and my arm is called brachial. My armpit is called axillary, and my front elbow is called antecubital. The back of my elbow is called olecranial. My forearm is called antebrachial. My wrist is called carpal. My palm is called palmar, and my thumb is called pollex. And now I am laying on my side, and this is my femoral, which is my thigh, and this is my crural, which is my leg, and the anterior of my knee is called patellar, and my ankle is called tarsal. And now I am facing downward, and my back is facing up, and on my posterior side. The back of my skull is called occipital, and my shoulder blade is called scapular. My spinal is called vertebral. My back is called dorsum. My loin is called lumbar, and the region between my hips is called the sacral. And hey, this is my foot. So my heel is called calcaneal. My sole is called plantar. My toe is called hallux, and my toes are called the digitals. And now, if you want to see what's inside of my body, there are 3 ways to cut my body open. The first way is parallel to the long axis, which is called the sagittal. If you cut from the middle, it's called the mid-sagittal, and of course, you can cut it parasagittal. And perpendicular to the long axis is called transverse. Diagonal to the long axis is called oblique. Alright, there goes my physical examination. Thanks for watching. Thank you, Dr. Yufi.